Palantir faces a massive opportunity in this $8 trillion industry. It's not defense, but it is as critical. Hi, I'm Arni, and this is Palantir CTO Shyam Sankar. The interview is from a couple of years ago, but it is very relevant for today.
It's good to see you, Shyam. So clearly it's coming off of a low base, but there's a lot of potential. First, COVID, I know, is big for you in terms of managing some of the government's work on vaccines and medications, and now monkeypox. Tell us about it.
Well, thanks for having me back, Sarah. Absolutely. You know, one of the things that makes our presence in healthcare unique is that we span the entire value chain. So, of course, working with government agencies to help them distribute vaccines efficiently, plugging into the pharma companies and the biomanufacturing processes that create them, driving the hospital operations that is getting those needles into your arms and driving the healthcare outcomes, clearing the backlog in the wake of COVID.
Why should investors care about this? I talked to our team actually reached out to a number of analysts ahead of today wondering about the healthcare business, and they said it's still such a tiny slice. Clearly, there's growth there. How big of a part of the business do you intend it to be?
I think healthcare is absolutely massive. The number of opportunities that we're seeing to help the U.S. clear the patient backlog with hospital operations, to deal with nursing shortages. COVID really put healthcare on its knees here. It showed the weaknesses in the system. It spurred innovation. It's created funding to go after and fix these problems. That's as true in the U.S. as it is in the U.K. and Canada and continental Europe, in Japan. And so we see a lot of opportunity all the way from the preclinical, clinical R&D side through clinical trials, all the way to the payer and provider side.
So Palantir faces this massive opportunity. And Shyam says we can capture it because we are spread across the entire value chain. What does that mean? Well, we mainly know Palantir Healthcare from the contribution it had during the pandemic. First, it helped with the CDC, the Center of Disease and Control, to help allocating resources to hospitals. Then with the vaccine distribution. Then again last year, the eternal saga of the NHS England, the famous $400 million deal for the Federated Data Platform, was painful, but we got it. But this is the government side. Then there's the commercial side, which is actually quite more interesting. Healthcare, according to our friend Adair Square, generates almost 10% of the total active links for Foundry, being the biggest vertical. Among the commercial sector, Palantir has some big pharma companies. They have Merck, they have Sanofi, and they have Novartis, for instance, whose CEOs has something to say about Palantir.
I'm excited as well for AI to support R&D in particular. I mean, it's going to revolutionize just the basics of how we operate as a large company. But I think it's going to change drug discovery and drug development. We have one really fundamental advantage, I think, versus our peers. 5 years ago, we invested heavily and created an integrated data lake we call Data 42 with our partners at Palantir. And now we're leveraging that data lake to move AI very quickly forward in the company. And I think this will give us an advantage because our data is organized, it's got a clear ontology, and I'm hoping that will lead to new discoveries faster over time.
That's a whole nother segment for another day. That's really exciting. I did not realize the Palantir link there. Boss, thank you very much.
I'm excited as well for AI to support R&D.
But it doesn't stop there. This is from a couple of months ago, where Palantir is defined in a peculiar way.
How is AI affecting your company, and do you think it's going to help your company?
I think AI is going to have a big impact, but I think it's going to take more time than most people expect. I think first, in productivity areas, AI has immediate applications. And I feel like in productivity, we can use AI for document management, document generation, not really sexy areas, but things that really tractable. In our sector, most uniquely, the big question is, can you speed up or increase the efficiency of drug R&D? And there we're doing a couple of things, working on clinical trials and optimizing our clinical trials. But the big bets we've made are with Palantir, Microsoft Research Labs, Google DeepMind, and a few other partners to say, could you really discover novel drugs that maybe weren't discoverable without AI? Can you optimize drugs much more quickly? And this is all building on the pioneering work that Google DeepMind did on a technology called AlphaFold. There's a huge opportunity here, but I think we also have to acknowledge that we only understand about 5 to 10% of what is going on in the human body. So to expect AI to use that 5 to 10% to extrapolate and come up with big discoveries is going to take time.
So you see also here, massive opportunity. Fine, but why there is opportunity? Like tell me some evidence that there is this opportunity. And this is a study from BCG, one of the leading consulting companies, sharing how the healthcare industry is expected to dominate the generative AI growth. The generative AI TAM, the total addressable market, is expected to grow as a market for a CAGR of 66%. But then there's healthcare, growing at 85% CAGR. So essentially, AI for healthcare is expected to be the fastest growing part of the generative AI market, where Palantir is involved with its platform, AAP. And guess what? Palantir already knew it. Palantir is already preparing, and it was warning us back in 2022. Palantir Healthcare generated $153 million revenue in the first half of 2022, up from 42 million in the first half of 2020, essentially tripling in 1 year. And here we see pharmaceutical, biotechnology, insurance providers, regulatory agencies, research organizations. So Palantir knew that this huge wave would have arrived. And we know why Palantir is actually succeeding in healthcare. It comes directly from Carpetto. Thank you, Amit, for sharing this quote. Healthcare is ideal for Palantir and AI because of the regulatory and litigation challenges. We need software to manage complicated engineering and societal variables. Our software is impactful in healthcare, particularly in handling resources and litigation challenges. In healthcare, our software powers a significant percentage of US hospital beds. The use cases are intricate, involving optimization and ethical decisions. Our software helps manage scarce resources, integrated highly trained workers, and handle complex decisions systematically. In this quote, we essentially see that Palantir strives in healthcare because healthcare is complicated, the stakes are high, like for the military, and is heavily regulated. When you have a high regulation, you need software that works, and you need to be able, since the life is on the line, to reconstruct how you made certain decisions. And that is the perfect fit for Palantir. So perfect that when Karp mentioned our software powers a significant percentage of US hospital beds, that was in October, and Palantir was covering almost 16% of the hospital beds in the US. That was 0% of a couple of years ago. And just last month, 2 months ago, in February, Karp said we power almost 20% of hospitals in the US. So the percentage seems to be increasing. So Palantir is pushing hard. And the other day, I shared this demo, 15 minutes, you can find on my profile on X, and this tweet. So Palantir had bootcamps with more than 40 healthcare systems over 2 days. Palantir wants to take the whole market. And in this picture, you see many potential clients that we have never seen so far. Palantir made AAP for hospitals event, 300 more attendees from over 80 health systems. They developed Palantir AI for Hospitals Starter Pack. And you can even have virtual bootcamps. So essentially, Palantir is pushing very, very hard here. What are the benefits that Palantir is actually achieving with these hospitals? Here is a nice example from Tampa, where we can see Palantir helping from an operational level, from a financial level, helping saving revenues, and from a clinical standpoint. So essentially it helps the hospital running its core operations, the clinical operations, its business operations, so helping allocating beds effectively, and the financial standpoint, capturing the biggest amount of revenue possible. Then we have another example from Mount Sinai, where Palantir helped delivering $1.5 million annualized saving, and that was from just 1 or 2 months. 1.5 days less patient length to stay, 11 more patients from emergency department, more than 100 admission to the hospital at home, and so on. So Palantir saves cost and Palantir saves lives. there is another example that I wanted to share with you. Then this comes from HCA Healthcare, so another private hospital, which participated to the first IPCon, where they said, okay, we made the first penetration of Palantir with just one department, one facility in January 2023. And then in only 4 months, they deployed Foundry and AIP to 50 departments and 4 facilities. And they expected to expand. Boom. Voila. Second AIPCon, they participated again. And they were 6 months ago at 150 departments, 9 facilities. This in September. But now time has passed and we should be theoretically right now here. 400 departments, 40 facilities. So we went from 0 to 40 facilities, so 40 hospitals in a year and a half. Massive. But how massive? How that contributes? Well, this HCA Hospitals is not a random company. This company is the largest health system by the number of hospitals in the US. It's massive. 200 hospitals, 219 hospitals. Essentially, Palantir is already at 25% of these massive organizations. And do you think Palantir is going to stay flat, don't expand more? If they're so happy with the expansion, how much time Palantir require to replicate what they've done here into this leading company, HCA, to other hospitals? Do you think the competitors will watch HCA leveraging Foundry, getting a lot of benefits and not willing to at least try Palantir as well? Will Palantir actually capture the entire market of health system providers? Let me know in the comments below. And if you want to know how Palantir is actually fastening its client acquisition phase dramatically from the new product, watch out this video that will appear here. Remember to subscribe to palantirbullets.com, my newsletter, for free, and to my Twitter, link below. So thank you from Arnis Noel, and see you in my next one. Ciao!